Hi everyone and welcome. You're with Jackie Mayer from MDeverywhere's Credentialing team. MDeverywhere provides cloud-based revenue cycle management technology combined with expert back-end billing and credentialing services to physicians. I'd like to thank you for joining our Express webinar today. We value your time, so we'll do our best to keep to just 15 minutes. Quick housekeeping note, if you have any questions, type them into the chat window on your control panel. We'll follow up after the webinar. Yes, everyone will receive a copy of the recorded webinar as a follow-up to today's presentation. Or you can view the presentation on the MDeverywhere YouTube channel. Let's get started. Our topic, smarter credentialing gets you paid, reduces denials, and increases patient satisfaction. Today we'll review several factors which can delay credentialing and impact your ability to collect money and schedule patients. Don't be derailed when you hire a new practitioner, merge practices, acquire a practice, or you encounter contracting glitches. Let's start with the most common scenario, hiring a new physician. As important as it is to know whether your new hire meshes with your organization's culture, and if their training and experience is a fit, you'll be asked to pin down a start date, otherwise known as when can we get paid. There are questions you can ask and should ask early in the process to anticipate challenges and avoid delays. If you have the luxury, choose a start date with at least 3 months lead time. I did say luxury. First, let's discuss recent graduates. If your new hire is just completing a training program, you'll need to know their board status, and if not certified, when will they be sitting for their boards? Some plans with mature networks are requiring board certification and will not accept a board admissible applicant. You should keep up with changes and requirements for all plans representing at least 80% of your practice. Recent graduates will need to update their NPI status with their new taxonomy code. You'll most likely need a CAQH ID number. You'll have to create a CAQH profile and, of course, start the credentialing and contracting process for all of your plans. You should initiate the process as soon as a contract is signed or an offer is accepted. Depending on the specialty, your new graduate will need hospital privileges and an active liability policy to move through the credentialing committee process. Second, is your new hire relocating from another state? Know that they will require new Medicare and Medicaid enrollments. In addition, national commercial plans may require new credentialing by the local market. Local Medicare and Medicaid HMO plans will vary within a state and always vary from state to state. Consider a relocated physician as you would a recent graduate for credentialing purposes and budget ample time to credential. We often have groups confidently telling us they participate with everything, and then they're surprised when they see the time frames that are involved in the credentialing process. As soon as your new hire has a state license and CDS, if that's applicable in your state, get the research and credentialing process going. Make sure your new hire is aware that they must sign and return documents in a timely manner prior to their relocation that will require original signatures, witnesses, or notary involvement. Again, their NPI and CAQH profiles will need to be updated prior to initiating credentialing so you can avoid delays. Hospital privileges are a consideration here as well, in that lead time is needed and usually an in-person interview is required. We advise you to have the new hire obtain a DEA with their local address. Good communication and planning will result in a more successful onboarding of a provider who's been relocating to join your practice. Next, is your new hire coming from an existing practice in your service area? If so, look at the list of plans accepted by his or her former group. If you feel like you've hit a home run when you hear, I participate with everything, or we accept all insurances, again, you need some detective work. Here are some potential delays. First, was their former practice a hospital or a facility? If so, was their specialty credentialed? For example, some hospitals do not credential emergency department providers in health plans. Even though the facility's list of participating plans is extensive, this does not mean that your hire has been credentialed or is participating. Hospitalists have the same issue. Also, look at the plan's products. For example, participating with United Healthcare does not mean that they're credentialed with a community plan. If the old employer accepts PPO or Medicare PPO lines of business and your group accepts all HMO and Medicaid products, you'll have some credentialing to do. Ask your new hire if they have any employment limitations should they leave their current group. Competition for primary care physicians has never been fiercer. Providers may not remember what they signed, and they may be restricted from contacting patients and enrolling in some plans for a specific time period outside of their old employer. Finally, has your new hire opted out of Medicare? By opting out, a doctor or practitioner has decided not to provide services through the Medicare program and not to bill for any services or supplies they provide to any Medicare beneficiary for at least 2 years. Note that opting out is not the same as enrolling with Medicare as non-participating. You can check your intermediary's website to look for listings of providers who have opted out. If your new hire is coming from a hospital-based group or a very large practice, was their former group delegated? Delegation is when plans will review and accept a group's documented credentialing process. Physicians will most likely not know whether they're credentialed via a delegated arrangement, so you may need to contact the plans and ask a very specific question. Is Dr. Smith credentialed under a delegated group? Credentialing under delegation is usually only applicable while the provider is working under the delegated group. So once they leave that group, the plan is notified and they are no longer considered credentialed. You will need to initiate the credentialing process again. Delegation is very common in large markets, so ask the delegation question early. So, before you feel confident, you only need to forward a letter and a W-9 and wait for the demographic update to move the new physician across town to your practice. Ask the right questions. When researching participation, confirm the provider is credentialed and participating. Some plans issue non-PAR numbers which can appear on the new hire's participation list and give you a false sense of security. Next, we'll review credentialing considerations when merging or acquiring practices. You'll notice we're addressing some contractual and demographic load issues here. Not quite credentialing, however, contracting and demographic maintenance are part of successful credentialing activities, and in most practices fall under the same staff. As soon as the decision is made as to which tax ID number you'll be using for the new blended entity, start the credentialing process. For a newly created TIN, a new NPI and a new Medicare group and plan group contracts will be needed. Even if you're not changing the tax ID number and NPI, Medicare and Medicaid will need to be notified of a change in ownership or corporate structure, so don't overlook this step. Plans will need to add the tax ID number to their systems, and you may have to establish new contracts. Will your remittance address change? Also important. Next, what's the participation philosophy for each of the groups? Blending requires that you review the plans, contracts, and products each group has been accepting. If your practice accepts all plans and your new partners never accepted Medicaid or HMO plans, for example, you'll have some credentialing work to do. Allow for the credentialing lag here. Next, are you taking your tax ID number to another state? Make sure you've established your practice as a business entity in the new state. Now your legal counsel needs to do that. And start to contact your local plans to see if they can assist or provide a contact in the new contracting area. New Medicare and Medicaid groups will be needed, and contracts with the local plan markets will probably be required. Review hospital affiliations of the blended group. For coverage and plan participation, there may be some hospital applications to initiate, and these may take a little bit of time. With tax ID number and group changes, follow-up is tricky. If you're changing a tax ID number but not the practice location, calls to plans for a status need to be clear and detailed. For example, I would like to confirm that Dr. Smith is affiliated with tax ID number such and such, with a location of such and such, and a remittance address of such and such. You want to confirm the effective date of the physicians under your TIN and whether they're loaded as participating. If you intend to keep some partners in the practice as non-participating, speak with the plans first, as many plans require that all providers billing under the same tax ID number are participating. Next, credentialing and contracting. What comes first? Chicken, egg, credentialing, contracting? Well, for credentialing and contracting, the answer is all of the above. Some plans credential before they contract, some do the opposite, and some handle simultaneously. Credentialing may be handled by a national team and contracting by the local market office. Always ask about the contract status when you get the good news that your provider is credentialed. Not all plans have stellar communication internally or a smooth process for completing all steps of your provider's enrollment. If you have group contracts, new providers will need to be added, but again, this does not eliminate the step of credentialing. In summary, ask your new hire for all relevant information to proceed with credentialing as soon as the affiliation is confirmed, and ask specific questions to identify potential delays. Never accept "I participate with everything" at face value. If you do, you'll be waiting for a demographic update that never happens. You'll put your start date at risk. Do your research. Next, have a realistic start date whenever possible. When not possible, accept that your new hire will be generating out-of-network encounters, which can cost patient deductibles and coinsurances and may lead to denied claims for you. Knowing the credentialing and contracting process for your larger plans and how effective dates are determined is a must. You should also keep up with whether your plans are using specialty networks for behavioral health, physical therapy, radiology, etc. When adding a new specialty to your group, the rules may be different, so always check that out. Now, for the hint of the day. If you're in the credentialing process for a new hire and they must perform a procedure or schedule a patient with a network plan where they're not permitted to seek services outside the network, call and ask the plan for an out-of-network authorization for the service. Explain that the provider is in the credentialing process and why this provider must render this particular service to this patient. Be prepared to share clinical details and advocate for your patient by making the attempt. Okay, we hope you found this information helpful. I'd like to take a minute to talk about MDeverywhere for those of you who may not be familiar with us. We provide cloud-based revenue cycle management technology and expert back-end billing and credentialing services to physicians. We provide service to approximately 6,000 physicians nationwide, ranging from solo practitioners to mid to large-sized group practices and up to faculty practice groups and hospital organizations. We provide our clients with an online patient portal called Patient First, which keeps their patients in touch with their physicians and provides an easy way for patients to make online payments. I'm particularly proud of the top-notch credentialing enrollment services we provide. Follow MDeverywhere on Twitter, LinkedIn, and register at our YouTube channel for valuable practice information and resources. We will follow up with any questions submitted after this webinar, and a link to today's recorded presentation will be sent via email to all attendees. Thank you so much for your time, and have a great day.